Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Neer Patel is an engineer by degree, but an entrepreneur at heart. He helped build and grow his wife, Dr. Katrina Iqbal's direct primary care practice, My DPC, throughout Central Texas over the past 9 years by shielding patients from the broken healthcare system. Now DirectMed is at 4 locations with 7 DPC physicians, and he has learned that the group healthcare insurance system was also severely broken and started working with other employer groups to teach them how to break free from it. Angel Saucedo has been a health insurance advisor for over 15 years. He has worked for agencies of all sizes, from startups to publicly traded companies. As a published author, he has always seen the value in constantly learning and finding creative solutions for his clients. Currently, he is the senior partner at Virtuous Benefits, an insurance agency that incorporates DPC memberships into ACA-compliant health plans that do not have any network restrictions. Together, they opened Virtuous Benefits in 2020. Thank you for tuning in. Find out more about DPC, including resources, discounts, my favorite tech tools, and books at mydpcstory.com. The mapper has been updated so you can look for practices by specialty now. Follow us on your social media platforms at our social handle, My DPC Story, and be sure to subscribe to our newsletter and, of course, the podcast so you won't miss out when the next episode drops. So with that, I want to welcome our guests. Welcome to the podcast, Neer and Angel.
Thank you. Thank you.
The conversation that we're about to have is pertinent because whether we like it or not, even if you have never thought about working with employers are wanting DPC. So I think that's where it's very pertinent to have this discussion. And you might be familiar with Neer's voice. He has been on this podcast with Dr. Katrina Iqbal in the past. I was listening to the episode again today, and I was like, my goodness, how much time has passed. I had an infant at the time, and now I have a 3.5-year-old and a 6.5-year-old. And so it's wonderful to see not only your practice growing, Neer, but also the fact that you guys have grown Virtuous Benefits and have helped so many DPCs. So with that, let's start off talking with what is Virtuous Benefits. Can you share with the audience, what do you guys do at Virtuous Benefits?
Yeah, so we created Virtuous Benefits with the mission to fix the broken health insurance system for employers around the country of all sizes. We created our agency to operate very similarly to a DPC practice. Our compensation is a monthly membership fee based on the way people elect coverage, very similar to a DPC membership, the way people get care. And we are a touch point to the member every single time they need to go outside the DPC office for literally anything, a medication, a specialist, an image. And we help guide them through the process so that everything goes really smoothly for them. Because their card doesn't say a recognized network name on it, they're not going to be well received if they try to navigate the system by themselves. And we help them through that process as a full service agency, operating very similar to a DPC for everything that they need outside the DPC office.
We're benefit advisors. We design health plans, ACA compliant health plans that have DPC at its core. So it's not an add-on, it's not something elective, it is part of your health plan. And we also incorporate reference-based pricing, which means you can literally go anywhere you want in the country. So we help companies navigate through the health insurance industry, and we also provide care navigation for their employees, seeing that it's a very new thing for them. They're going to need some help along the way, and we're happy to provide it with them.
And as we know, patients, they're so hesitant even to do anything other than, what does my insurance cover? And thankfully, we are seeing the scales change. More people are asking for DPC, more doctors are looking into DPC. But it's very awesome that you guys are understanding, especially as DirectMed has grown, from the DPC perspective, what we do and how mirroring that type of care, the type of access it's wonderful to see that. So let me now ask about a comment that Angel, you had made at the Nuts and Bolts conference where you had said that nothing can stop DPC. And so this is one thing that I think is very important to the discussion because, as I mentioned, employers are definitely looking for DPC, but we are in an election year. Our country is in a very tumultuous time right now. And we have an HSA bill that is, again, potentially could be voted on, potentially could not because of the political scene in our country. So when you say nothing can stop DPC, not only Angel, but Neer too, I'd love to hear your perspective as to the years that you've been working with advising an insurance angel and with Neer, you seeing what has happened with Katrini's days going from urgent care and teledoc to you guys have 4 locations and 7 doctors. What evidence can you speak to that backs that statement up?
Me, when I made this statement, it was coming from an outsider. The DPC movement has grown just based on what Neer has mentioned to me and what I've seen, to where there was a few hundred doctors maybe 10 years ago, to now there's thousands of doctors with more and more either starting a DPC practice or joining one. It seems like on a monthly basis. And it can't be stopped because doctors now know that they can practice medicine with the patient's best interest at heart and be financially successful. Speaking of doctors, just getting to know them throughout these years that we've started, it seemed like doctors were either making good money but being miserable at their job, or maybe doing some community outreach, helping patients, but they weren't able to financially sustain themselves. So it almost seemed like you had to give one or the other up. But with DPC, you can truly have both. And now more and more doctors know that, and they're telling their friends. So you can't stop that.
And I would say DPC is unstoppable from my perspective, just from the 10 years that we've had our own DPC practice and have grown it really organically. We've never put an ad out for a physician. We started it with one tiny room and 0 patients, and we grew it from there with word of mouth and community engagement and education. And then when COVID hit, physicians started coming to us just out of the woodworks. I heard you guys on My DPC Story, or I saw your website. Is there an opportunity for me to work with you guys? I'm not happy working in the traditional system in the place that I am. And so as patients were coming and coming, physicians started to come and come as well. And it's a magical thing when you can pair up a physician and a patient and no other outside influences and just have that care and that relationship happen and flourish.
Amen. And I was thinking, Angel, when you're talking, it's like ChatGPT, you can't put that genie back into the bottle. So it is awesome that you guys have seen the growth at DirectMed. You've seen you don't have to invest the money in marketing necessarily to find other doctors. Definitely the experience is all over the board in terms of finding doctors, but I love that you guys have had that experience. And I will make a note here that in the show notes, as well as the blog accompanying this podcast, you can find Dr. Iqbal and and Neer's episode from 3 years ago. So you can hear what it was like even back then, because you guys only had a second doctor and you were about to add a third during that interview. So pretty incredible, just a change in such little time because of the demand of doctors wanting to do DPC and patients wanting DPC. So when it comes to employers and the trends that we see in the employer space, can you also speak to why an employer would even want to start coming for a DPC to ask, hey, what would the possibility be like if I had your DPC practice as the healthcare provider and clinic for my employees?
Seen 2 major things that really pop in an employer's mind and why they try to pursue it. One is they're already a DPC patient, and so their thoughts are, well, I already like this care. It's a lot more affordable. It's easier to get in touch with them. How is it that my network carrier can't do this? Like, how is it that I found this, but nobody else is talking about it? So that is a good segue into talking to them about what we do. The other, obviously, is cost. Employers obviously have a business to run and they're trying to be sustainable and profitable. give their employees raises. But if their healthcare cost is going up and up, more times than not, they have to sacrifice that raise to pay for their insurance. And so it's a blend between cost and the quality that they've seen. So that's what I've seen, the reason that employers are starting to gravitate towards DPC.
And from my perspective, in addition to what Angel said, I would say that acquisition and retention of really good staff is another big picture problem that's happening in the employer space, right? Employers are constantly looking for the right talent to bring into their practice and to bring into their company and to keep them there so that they're happy and they enjoy the work they're doing and they're productive as the company grows. And benefits are a big part of that. If you don't have the right benefits, you're just not going to be able to attract and retain the right talent. And they will move to other places that they even perceive have better benefits.
And especially if you're a small business, I think about how we saw a lot of people during the pandemic choose to not stay. A lot of people were eliminated from their roles and were out looking for jobs. And even in a mom and pop business, if you have 8 people looking for work and 4 of them are high quality, and those high quality people want the best option for them, including a healthcare benefit, even if it is not a typical BUCA plan, that's something that the employer can bring without spending tons of money. We had that experience at our practice this week where we just had 2 people who were like, we don't have traditional fee-for-service insurance, but we didn't even know that this was an option. And so now the employers, oh wow, I totally would do this because of what you're saying here, especially this is a way for me to also encourage my employees to stay. And it is so useful these days when sometimes it's hard to find good employees. So now before we even get into the nitty gritty of working with employers, I want to take a step back and just talk about insurance. Like we know what insurance is, in terms of we have the card, it's ridiculous, the entire third party payer system, but what to you guys, if you were talking to a patient or an employer or a DPC doctor and you were asked the question, what is insurance? How would you answer that?
So I would answer it a couple ways. One is at its very core, insurance is the transfer of risk, right? I have this risk that I need somebody to manage. You're going to protect me, so I'm willing to pay you to manage that risk. When it comes to a fully insured health plan or a network health insurance plan, which is your Blue Cross Uniteds of the world, that's what people consider as insurance. You have to figure out how does that work behind the scenes? Because, like you said, they know their card, they know they don't like it, and it keeps going up. But for the most part, a consumer does not know what happens behind the scenes. How is this insurance structured, right? They just know here's my card and here's how it works. And so that's really where our education starts. Anytime we're engaging with someone new, employer or even a DPC, we start with how does your Blue Cross or United Health Plan work behind the scenes? What are they not telling you? And so I'll touch on one point and we'll go back and forth with Neer and I. So I'll touch on the rate first. How do they come up with the rate? And so it really comes down to 2 categories. If your company is less than 50 employees, or if it has more than 50 employees. If it has less than 50 employees, then typically they're only getting simple demographic information. Everyone's name, birth date, gender, zip code, sometimes if they use tobacco or not. But that's all the data that they give an insurance company. And so what I always ask the person I'm speaking to is, how does the insurance company know if that person is 50 years old and healthy or 50 years old and on 10 medications going through a serious treatment? The reality is that they don't. And so now knowing that, do you think the insurance company is going to overcharge you or undercharge you if they don't know the risk that they're getting into? And of course, the answer is they're always going to overcharge you because they don't want to pay for those losses. So most people, most small employers are overpaying for their insurance because the insurance company doesn't know the risk that they got into. If you're over 50 employees, there typically is some sort of claims data that is provided, but that claims data is overly inflated. And I'll let Neer talk about why is it overly inflated.
So health insurance to me is a way to finance healthcare, right? There's that misconception between what is healthcare and what is health insurance, and are they the same thing or are they different? Most people in this country seem to be programmed to think that my health insurance is my health care. The health insurance is simply a way to finance the health care, right? The physicians and the healthcare professionals in this country are providing the health care. Going back to the network, as an employer, you really want to understand, is this network that I'm being sold by my advisor from Blue Cross or United Healthcare or any of the other big networks in this country, is this network actually helping me or hurting me? And that's really the question that everybody needs to understand, because what happens behind the scenes, how do these insurance companies actually make money? They don't just make money off of our premiums. That's just the starting point of where they make money. The real place they make money is from the network that, when you think about it, they're forcing you to use. They double your deductible, they reduce your benefits. If you go out of network, they have an in network and out of network benefit schedule. There's a reason for that. And it's not to protect us, it's to protect them and maximize their profits. A doctor's visit can turn into $1,200 really quick by all the administration that gets added to a bill when it goes through a network. And the Blue Crosses and the Uniteds of the world don't have to ask anyone's permission to pay themselves $1,000 out of that 1,200 and then give $200 to the physician. And so that happens every step of the way, every single time every single person uses their health insurance card with a network-based plan. The question employers really should be asking themselves, is this network helping us or hurting us? And do we actually need this network? And the answer to that is no, you do not need a network, because if you showed up anywhere at any healthcare office in the country or hospital and tell them you're uninsured, but you have a wad full of money, they're going to figure out a cash price. And that's the reason why we don't need a network and all this unnecessary administration added to bills.
So that's why claims are overinflated, because if you see $100,000 paid in claims, your network carrier doesn't say, "Oh, we actually paid ourselves 50,000 of that 100." They'll just tell you there was 100,000 in claims. So when you see an increase in your rate year over year, it's really adding insult to injury, because not only are they charging you more for the insurance per month, they've paid themselves way more throughout the year. So they're getting paid twice, right? But that's the insurance that everyone knows about, right? That's what, again, that's what we're told for the past 50, 60 years. You need a network. Nobody is going to give you care without a network. But as Neer mentioned, if you showed up with cash, somebody's going to figure out a price.
It's crazy because even though we know that's true, because that is a fact for us, so many people in this country, they have no idea that you can actually buy healthcare like your bread at the grocery store. And then you also have the frustration of when a person does know that they can pay cash, the front office staff is, no, we don't do that. We just take insurance here. It's like, that's actually not the case, but it's because nobody has informed them, what the laws are, what the rights are of a patient, and that a patient does not have to sign that gosh dang clipboard when they go to see their doctor. So now let's talk about the different types of insurance. Now, again, if you've heard Dr. Iqbal and Neer's episode, he definitely touched on this in that episode. But for those of you who haven't, or just as a refresher, can you talk about the different ways to develop a plan for people so that they're not only looking at what's in my Buka network?
So again, I'll touch on what everyone's used to, because that seems to be the quickest way to explain it. So again, your network carrier, you're fully insured. That means I pay my premium, $500, $600, $800 a month, whatever that is, and I never get to ask any questions. Is there money left over? What happened to it? Do we get the best deal? But I pay that money every single month, and at the end of my contract, which is typically 12 months, I get an increase, and no explanation is given to me on why. That's the fully insured model, again, that most people are used to. When you start talking about self and level funded plans, they're actually structured in a very similar way. They have stop loss insurance, which is what we call the real insurance. It basically protects your company after a certain threshold. So if a claim hits over 10,000 or 50,000 or whatever metric you set it at or threshold, the stop loss carrier will pay for that claim. Fully insured actually has that, but again, they don't tell you anything because you don't get to ask questions. On a self-funded plan, you essentially are building your own health plan. You're putting it together with the different vendors. We typically hire what's called a TPA, third-party administrator. They're the ones collecting all the premiums and paying it out to the vendors, right? Keeping track of the claims. You typically want to have a vendor that's in charge of getting the medications right, outsourcing them to, internationally sourcing them, or just providing a better solution. So it sounds to me self-funding is building your own health plan and hiring someone to manage the risk. But it's the same model, is the same structure as a fully insured, but you get to ask questions and you get to see where the money goes.
I also wanted to address just something that I've run into with some DPCs that kind of say, I have a policy that I'm not going to allow anybody else to pay for the patient's membership other than the patient. And I completely understand why some DPCs have that sort of policy or mentality. But I want to help clarify for some of the DPC physicians that might be wondering what can go wrong in a situation where an administrator pays me for the membership, right? And so with the way that we handle things and the way our agency is set up, we're doing this in a 1000% genuine way. There is nobody that's making any decisions other than essentially the employer with our guidance, right? We're the consultants that they've hired to basically offload all of this healthcare management to. And they follow our guidance and they essentially do what we advise them to do. When we're hiring a vendor, all we're doing is a TPA or a third party administrator, all we're doing is hiring them to manage the money, right? They're just collecting premiums and then they're paying it back out to providers and facilities and DPCs and basically everywhere that we tell them to pay the money to. Prior authorizations, those are only done because we have a stop loss insurance carrier that if they take a hit, if they have to get involved on a claim that goes over $100,000 or whatever threshold we set, they need to have documentation on, was this medically necessary? Why did it get approved and paid for? And so it's basically just documentation so we understand why this particular condition or medication was, or treatment or medication was followed. And so when we have prior authorizations coming through our agency, I tell the DPCs, literally just send whatever you have. I just send whatever record you have, and that's it. And then I pick up the phone and I tell the TPA to pay the bill. So it's really not a complicated process like we're used to in the traditional system.
And there, can you talk to the premium, I guess, in the sense where, and the concern that some DPC doctors have that if they even start talking with employers of any size, that they're going to have to change their rates. They're going to have to provide 24/7 care. They're going to have to build a chiropractor into the plan. I've heard different examples of how people are hearing the word employer and then reacting to it.
It's a great question. So just like patients that aren't familiar with DPC don't understand the breadth of what we can do, employers also don't understand that, right? The executives that kind of get in a room with a bunch of advisors also that might not understand that. They're going to cook up all these nonsensical ideas and reporting requirements and all kinds of things that have no logic around them on why we're doing them and why we're making these doctors that we're building into our plan do these things. And so that's the other thing that we do is I'm one of those people in the room every single time advocating for the DPCs and educating everybody that's not familiar with how things work, that we don't need any of these things, right? I help everyone understand the DPC is very well trained generally to handle about 90% of all the care that everybody needs. They've already got the relationships with specialists and facilities, and they know who takes the best care of the patients and gives the best prices. And we're going to follow their lead. We're going to put the trust in them. And there is no reporting that they have to do because the proof is going to be in the pudding at the renewal meeting when we show you your claims activity is almost nothing. And the report that the DPC can spit out of their EMR is going to show you that everyone's using their DPC. There's lots of text messages and emails and phone calls and engagement between the physician and the patient. And that's the whole reason why you don't have claims. And the whole rest of the meeting, we're going to talk about all the money that you saved and what are we going to do with it next year.
We're very proud that our employers that we work with have a 90% participation in the DPC. LeVar Burton used to say, you don't have to believe my word for it. You can ask the employers we work with and the DPCs we work with, because we do that much more engagement in the DPC. We don't just say, oh, by the way, if you like it and it's the new hip thing, try it. We actively educate and go through some of the pushback that employees sometimes have of some of the reservations that they won't join a DPC. So we help them navigate through that. So,
and I also want to just add one more thing. I make it very clear to DPC physicians, there are zero strings attached to what your involvement in our health plan, and zero strings attached, even if the administrator is paying you on behalf of the patient. And what I mean by that is you're not going to change one single thing about the way you practice medicine. You're going to practice medicine the exact same way that you practice medicine for every single one of the rest of your patients. And if our member happens to become one of the patients that aren't a good fit for your practice, you simply let me know and we remove them from your practice. There's no questions asked. And I am the only contact that you'll ever deal with. There's no 800 numbers. There's no anybody else that the DPCs deal with except for myself and Angel.
So now, when it comes to the employer side of things, I would love to hear some of the things that you guys have heard from employers, no matter what size, in terms of the crazy things that you have heard from employers when you start the conversation about, hey, we could actually build an amazing healthcare plan to get your employees better healthcare access and save you money.
I mean, one of the misconceptions is that we're forcing everyone to either change doctors or change the way they make decisions about their own health, right? That's a big misconception. Just because we're educating and incentivizing, it's always the employee's choice at the end of the day that if they want to choose a DPC practice or not. We always include a non-DPC plan that mimics their most popular plan with their current carrier, just for those few that I call them rebels, the ones that just no matter what you say are gonna not listen. Another misconception that I say I've heard about is some DPCs feel if the employer is paying for the membership, then the employee won't value the membership. They won't even engage, right? They want the employee to have, as they call, skin in the game so they can engage with the DPC. We don't find that to be true, especially when we're the ones educating the employee. If you think about it from an employee's perspective, right? Most employees, when they go through their open enrollment meeting or finding out about their new benefits, it's very overwhelming to them, right? They're used to what they're used to, and now you're throwing at them, they have no network, and you're talking about this DPC. So it feels to them very unknown. And so they're scared about why do I have to now try a DPC? Why do I have to do it? So we help them. Again, we engage them, we make them feel at ease for it. But giving them access to a DPC is very similar to a professional sports team having a team doctor. If you play for, think of you're in Sacramento, if you play for the Sacramento Kings, you're going to have a team doctor that helps you if you get injured, if you have a nutrition question, right? None of those athletes are going to say, hey, why do I have to use the team doctor? I want to use my doctor, right? You already are provided a benefit. Take advantage of the benefit. So that's what I would say is two misconceptions that I sometimes have heard DPC say.
One of the other things I hear them say, employers say a lot or question a lot is, my current advisor or other advisors I've talked to have said there's not enough of those physicians that are doing DPC. There's not enough of different demographics and ethnicities of those physicians. How do we know we've got employees spread out all over the country? How do we know we're going to be able to have DPC available for everybody? And it's very simple to show them the breadth of what's happened over the last 20 years in DPC. We have various maps all over the internet that DPCs kind of put their landmark or their footprint on that's easily viewable. And when you expand it out to the full country, it's very surprising and to see now what it's transformed to from 10 years ago when we started our practice. But it's very clear to them. I call it like if you own an electric vehicle, looking at the supercharger map and you see the expanse of it when you're thinking about taking a road trip. It's the same kind of thing with DPC. You look at it and you're like, oh, wow, yeah, I guess that's not an issue. And so we've proven that time and time again with employer after employer that we're going to have an option within a reasonable distance for your staff wherever they're located.
As you guys have gone on these last 4 years, now going to be 5 soon, what are the stories that you've heard from the employees themselves with like, absolutely, I'll do DPC. I'm so frustrated with the system because of X, Y, or Z.
So a lot of times it's because someone on the executive team has already used, or within the company has used DPC. And so again, they're hearing it directly from a colleague that this care is great. This care is very different than what they're used to. In our employee presentations, we typically ask the DPC to be there and share their own DPC story because we want them to be able to engage with the member and say, look, I'm not doing this because I just didn't have a job or I wasn't making money where I was. Almost every DPC you talk to, they were making good money working for a large hospital or a large practice, but they weren't doing what's right for the patient. And so when an employee hears that is something they've never heard before, and they appreciate that doctor now is willing to engage with them versus before, nobody's ever had a doctor show up to an enrollment meeting before we show up. That's helpful.
And just some of the stories that you hear from like the members that you're helping navigate, right? And so we do that on a daily basis. We're hearing from employees in different companies all over the country about getting their specialist visits or getting their DPC enrollments scheduled and things like that. And just one kind of quick story from one of our larger employers in Alabama. The director is new and sprained her ankle playing tennis and had just joined the company and had just realized that they have a non-traditional health plan on DPC. And so we sort of helped her get expedited to get enrolled and establish their DPC because her mind immediately went to, I need to go to the orthopedist. So can you guys help me get that? And we were like, have you established your DPC? Let's do that first. They can do the initial evaluation, even order the imaging, and they can decide whether this is something that you actually need ortho for. And you might not, it might save you some money and save you some time to not even have to go there. And she went, she absolutely raved about her experience with Dr. Law, who just provides, she's an advocate in the state of Alabama. She was the very first DPC in Alabama, fought Blue Cross Blue Shield to allow DPC to come into Alabama. So she's very passionate about what she does. And she just provided such an amazing experience to this HR director for her first visit. She was shocked. She was like, I've never had this type of doctor's visit in my life. And lo and behold, she did not need to go to the ortho. And she was thrilled about that as well. And so it's those kinds of stories that just are so rewarding for us with everything we're doing.
It sends waves, just to add, it sends waves to the other employees as the year goes that this is actually in everybody's best interest. And so they start trusting us to the point, I'll share a quick story myself. At first, sometimes people think it's the insurance that's not helpful because when I go to my provider, nobody's heard of it in its insurance. But as they start working us throughout the year, they realize, no, the provider is the one that, how is it possible they don't want to take money? What kind of a business are you if you don't want to take money? And so, or why don't they answer the phone, right? They don't have their own practice running the way it should. And so they start realizing, you know what, let me just go to my DPC, let me just go to the people that they refer me to, because they seem to have it all figured out. So it's rewarding to see that happen over time.
No surprise hearing that the word of mouth basically is happening even amongst employees when you have people experience amazing care. That's how we grow as DPC practices, and that's how employees share amongst each other and how an employer really gets that adoption for sure. One of those questions came across my messaging today. It was like, so I can't get into the OB-GYN for an IUD removal for 3 months. Do you do that stuff or do you have to refer someone out? And I'm like, seriously, like you should tell Katrini that because as a family doctor, she'll just be like me, just shaking her head, like seriously, like as a medical student, you can do that. So it's just crazy that people don't even know what we are capable of when we have the time to take care of our patients. And it's awesome that more people are getting access to this care, even if it's through their employer these days. As our movement grows, we are now seeing ourselves having employees. Look at Direct Med, 4 clinics, 7 physicians, multiple staff. In terms of when you guys are thinking about the movement growing, do you talk to DPC doctors about how could we build something for our own employees?
So yes, when an employer invests in their own people, it really prospers the company. Because if you think about it, if all an employee cares about, hey, I just want my paycheck and I can get out of here, or as soon as 5 o'clock comes around, I want to get out of here. That's going to translate into the way they perform their job, right? That's also going to translate if they protect your company or they don't protect your company, right? If they see something that should be adjusted or that is not in your best interest, if they're just a hired hand, so to speak, and they could care less, they're not going to protect you. But if you invest in them, they will start looking out for you and their productivity would go up. And so that's what I've seen year over year, especially when a company says, look, we don't just want to pay for this insurance, even if it's the name brand that everybody knows. We want to make sure you're getting the results that you deserve as being a part of our company. We're proud to have you as employees. That gives a lot more, an increase in just not just the bond between employer and employee, but just the prosperity of that company.
We absolutely are helping other DPCs as they grow, create their own health plans. I use our health plan myself. My family uses it. Several of our physicians at Direct Med DPC use our health plans. They're thrilled. They love that they can just go anywhere, pay the cash price, and then get reimbursed, or we can give them a credit card to pay with if they need to. We take care of a DPC favorite pediatrician in Nebraska's practice. We take care of another DPC practice in Washington State. Yeah, there's several DPC practices that we help take care of and do the care navigation and help them save money.
Amazing. That is a wrap on today's episode. What I will say is a couple of things are coming down the pipeline. One is that we are going to be doing a live Q&A with Neer and Angel all about virtuous benefits, the employer space, working with employers, how they approach things. So come with your questions because this is the time that we're approaching the fourth quarter. This is the time when open enrollment is about to happen. So this is the time to get educated. So go to the events page at mydpcstory.com and sign up, and the Q&A will be live on August 20th at 2 p.m. Pacific. So definitely look forward to seeing you there. Now, in terms of the other part, we are going to be having an even more in-depth conversation about how to start the conversation, really the nuts and bolts of working with the employer, and also how to look at your own DPC from, could your DPC, the way it's being run right now, help the understanding and the adoption of DPC without more coding involved. You can find that on our Patreon community. So I hope to see you there at the Q&A, and I hope that you can join us on our Patreon community. So thank you so much, Angel and Neer, for joining us today.
Thank you for having us.
Thanks so much. It was a lot of fun.
And if you are looking for Angel and Neer online, please find them at virtuousbenefits.care. Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Maryal Concepcion.